What is the role of an anesthesiologist in a surgery is a question that is very often asked. So, whenever you're going for a surgery, there are two teams of doctors. One is the surgical team who's going to perform the surgery, and one is the team of anesthesiologists. Now, the role of anesthesiologist is to make you comfortable, keep you stable, and keep you unaware most of the times during the surgery. Now, the anesthesiologist decides on the kind of anesthesia, depending upon your profile of your diseases or your physiological profile and the kind of surgery that you're going to undergo. And there are various kinds of anesthesia that are available in these times. Now, first and foremost, the anesthesia which is considered to be least complicated and is used for small surgeries is local anesthesia. Now, local anesthesia is most commonly administered by an injection, but it also can be administered by sprays, by drops in the form of a cream, depending on the area that is going to be under surgery. Now, if you're undergoing a cataract surgery, sometimes it's given by drops and injections. Now, there are sprays used in ENT surgeries or during bronchoscopies, and creams are used for putting IV cannulas in children. So when we give local anesthetic, it is usually for a small part of the body. Like if you're undergoing a surgery on a finger, then the surgeon or the anesthesiologist is going to inject the local anesthetic drug and numb the nerves that are supplying to that area so that those nerves cannot carry any pain stimulus to the brain and we do not feel any pain. Now, these are usually done for small surgeries which last a shorter time. A surgeon or an anesthesiologist can repeat the dose of a local anesthetic once its effect starts to wear off, but they have to keep in mind that there is a limit to the amount of local anesthesia that can be used, and there is a toxic dose which, once reached, cannot be repeated. Now, the second type of anesthesia that's most commonly used is regional anesthesia. In regional anesthesia, a larger part of the body is numbed. So, the most common form of regional anesthesia used is upper arm blocks. In this, you inject the same local anesthetic drug around a bunch of nerves. So instead of targeting a single nerve, you would target a bunch of nerves, which would make your whole upper extremity or your lower extremity, a bigger part of your lower extremity, numb. Another very common form of regional anesthesia that is used is spinal anesthesia, which is most commonly used in cesarean sections, and epidural anesthesia, which is used for labor epidurals, which is to reduce the pain during normal deliveries. Now, in spinal and epidural anesthesia, using the needle, you inject a local anesthetic around your spinal cord, and in spinal anesthesia, in the fluid around the spinal cord. So that makes area below the waist absolutely numb. You are awake, you are aware, but the surgery can be carried out on the part below the waist without you feeling any pain. Now, this type of anesthesia, the regional anesthesia, is also used as a supplement under general anesthesia to reduce the pain during and after the surgery. So with pain, when you're under general anesthesia, you're not going to feel any pain, but your hemodynamics, like your blood pressure, can shoot if you are having pain without any analgesics. So regional anesthesia is used to supplement general anesthesia so that your hemodynamics can be maintained during the procedure, and after the procedure, you don't feel any pain. Lastly, the kind of anesthesia that most of us are aware of is general anesthesia. In general anesthesia, we can administer it by the help of an injection. So we put a cannula and then we inject drugs and you slowly doze off and you fall asleep. Or we can give you with the help of a mask. We put the mask over your nose and your mouth, and as you breathe, you would slowly fall into sleep. Now, these kind of anesthesias may cause some changes in your hemodynamics. It is a must, and it also uses a cocktail of drugs. There are many drugs that are used in giving general anesthesia, and these drugs are used for having different effects. Some drugs may provide you pain relief. Some drugs may be used for putting you to sleep or hypnosis. Some drugs are used to prevent vomiting post-surgery. So in this, we give you a cocktail of many drugs so that once you wake up, you are comfortable. So in general anesthesia, there are a lot of painkillers that are also given. And you are going to be completely unaware about the surgery that's happening. So the choice of anesthesia is decided by the anesthesiologist on the basis of the type of surgery that you're undergoing and also depending upon your disease profile. Certain anesthesiologists are contraindicated if you're on certain drugs. For example, if you're on anticoagulants or blood thinners, then you cannot receive spinal or epidural anesthesia. They need to be stopped before surgery in case you want to receive them. Similarly, if you have less mouth opening or your upper airway is difficult, then general anesthesia can be risky, and many surgeries are preferred to be done under regional anesthesia. And so the choice of anesthesia needs to be discussed between the anesthesiologist, surgeon, and the patient, depending upon the patient profile and the requirements of the surgery. And the best type of anesthesia is chosen for the safety of the patient.